Hello Brainerds, my name is Jace and welcome to the Big Brain Busters. In this video we are going to look at Balantidium coli, where we are going to talk about its morphology, life cycle, pathogenesis, diagnosis and treatment. And as usual, at the end of this video I've added some practice questions to see whether you've understood. With that being said, let's jump into it. So to describe Balantidium coli, we would say it is an intestinal protozoan parasite that belongs to the subkingdom Protozoa, the phylum Ciliophora, the family Balantididae, the genus Balantidium, and definitely the species Balantidium coli. And it is the only member in the ciliate group known to be pathogenic to humans. So ciliate meaning that it uses cilia as its mode of movement and everything. Like it uses cilia to aid it in terms of movement. Then it is the largest protozoan parasites in human that you can see. So amongst all the parasites that you see, Balantidium coli is like the largest. Okay, then it causes a disease known as balantidiasis with symptoms similar to amoebiasis or dysentery. Okay, so now let's talk about the history and distribution of Balantidium coli. So this is some just brief history about this man who first described it in the feces of dysenteric patients in 1857. Then when you talk of distribution, well, it is present worldwide and it has a very low prevalence of about 1%. Then the most endemic area where you can find Balantidium coli the most is in New Guinea, where there is so much close association between man and pigs because these people feed much on pigs. Alright, then let's now talk about the habitat. Well, it colonizes the large intestine of man, pigs and monkeys and other maybe cow or horses. And it is described as a zoonotic parasite. So zoonotic parasites, you must know that they usually infect animals, but then they can be transmitted to humans as well. So to describe the morphology of Balantidium coli, it exists in two forms, the cystic and the trophozoite form. Let's start with the cystic form. This is the this is the shape of a cyst. So this cyst is spherical in shape and it measures up to 40 to 60 micrometer in diameter. Then it is surrounded by a thick and transparent double-layered cyst wall around it. Right, then the cytoplasm is granular. As you can see, there are lots of granules in there, of which it contains a macronucleus here and then a micronucleus right there, like this outbulging there. Then the cyst is the infective stage of Balantidium coli. So do not mistake the infective stage and the invasive stage. So the infective stage of Balantidium coli is the cystic stage, while the invasive stage is the trophozoite stage. Then it is found in chronic cases and carriers as well, because you find that carriers won't have any symptoms of balantidiasis, but they will contain cysts in their stool samples, right? Now let's talk about the trophozoite form of Balantidium coli. Well, this is a large ovoid cell which can measure up to 60 to 70 micrometer in length, 40 to 50 micrometer in breadth. Then it is seen sometimes measuring up to 200 micrometers. It is that large, and it resides in the large intestine. As it is in there, it makes itself comfortable such that it will start feeding on cell debris, bacteria, starch grains and other particles. It is aided by cilia in terms of motility, and it is the invasive stage. So for it to invade into the colonic wall, it is this stage, the trophozoite stage, which it uses. Then that is the cilia, that these hairy substances that are around it, that's what it aids, it uses for movement. Then it is found in dysenteric stool. So if you get stool of a patient who has balantidiasis, you will definitely find these trophozoite forms in there. Then the anterior end is narrow and the posterior end is broader. So don't mind my drawing because this is just some demonstration, but otherwise you should know that the anterior end, this side, it is narrower than the posterior end. Then it contains a groove-like substance, a groove that is known as a peristome, which leads to a mouth known as the cytostome. So this is the cytostome right there in here. Then in this cytostome, you find a funnel-shaped gullet known as the cytopharynx. So this here, this dark shaded part here is this funnel-shaped gullet known as the cytopharynx. And then posteriorly, there is now this anal pore known as cytopage, where it uses for excretion. So this mouth-like cytostome, it uses for eating. Then the cytopage is used for excretion of waste substances. Then it contains a large kidney-shaped macronucleus. So this is the macronucleus, and a small micronucleus in its concavity. So here, this is the micronucleus in the concavity of the large macronucleus. Okay, then apart from that, in the cytoplasm, it contains a contractile vacuole. So this is a contractile vacuole and a food vacuole. So the contractile vacuole, it helps in regulating osmotic pressure in this particular parasite. Then the food vacuole, after the cytostome eats up some food substances, they are stored in the food vacuole. So the life cycle of Balantidium coli isn't that different as compared to that of Entamoeba histolytica, as infection is acquired from pigs and other animal reservoirs or from human carriers, such that when this human being eats this infected pig or contaminated food and water, the cyst that has been ingested will enter into the GI tract, and then it will undergo excistation in the small intestine, where it liberates trophozoites. Then these trophozoites will enter into the large intestine, whereby they will start multiplying by binary fission. As they are multiplying by binary fission, some of the trophozoites will become pathogenic, such that they'll start invading into the colonic wall. Then some of them will proceed in the large intestine, and then they'll develop a cyst wall by a process known as encystation, such that they can be excreted out of the feces, and then the cycle regenerates itself. Then sometimes they cannot multiply by binary fission. Infrequently, you find that these trophozoites can undergo a sexual union by conjugation, whereby there is a reciprocal exchange of nuclear material that takes place between two trophozoites enclosed within a single cyst wall. Okay, so the cysts remain viable in feces for a day or two and may be contaminated, may contaminate food and water, and that will lead to another transmission to other humans or animals. So the pathogenesis of Balantidium coli: in healthy individuals, this parasite lives as a commensal and symptoms are usually absent. But in immunocompromised individuals, such as malnourished, chronic alcoholism, achlorhydria, concurrent infection by Trichuris trichuria, and any other bacterial infection, there will be some clinical disease symptoms that will arise. And the pathogenicity of this particular parasite, what will happen is that the trophozoites invade the mucosa, and they are aided by the cilia and some lytic actions. They produce lytic enzymes such as hyaluronidase and proteolytic enzymes. These aid in causing lysis of the colonic wall, such that they'll start invading there, and then they'll start causing shallow round oval ulcers, as compared to Entamoeba histolytica, which produces flask-shaped ulcers. Then in those colonic mucosa, there might be some pus that might be formed. Okay, then mostly it does not cause extraintestinal infections as compared to Entamoeba histolytica. But if it does, like when it goes away from the intestinal mucosa, when it now invades into other parts, it might cause peritonitis and urethritis, such kind of things. Then, as usual, as we talked about it in the life cycle, we say that the trophozoites and the cysts might be excreted in the feces. Talking of the symptoms, in healthy individuals, they are usually asymptomatic. Mild balantidiasis patients who present with diarrhea without blood in the stool, alternating with constipation. Acute balantidiasis patients will present with dysentery, whereby coupled with mucus in the stool and a painful urge to defecate, abdominal pain, nausea, vomiting, headache, ulcers, shock may also result into death. So shock may be caused because of a rapid, or should I say a large, loss of fluids due to vomiting and diarrhea. Then chronic balantidiasis patients will present with anorexia, intermittent diarrhea with mucus, constipation, and weight loss, which is caused by anorexia because the patients are not eating. Then rarely balantidiasis may move to other extraintestinal organs such as the liver, the lungs, and the brain. Then when it comes to diagnosis, well, just like any other parasite, we can perform laboratory diagnosis via microscopic examination of the feces, where we are looking for the trophozoites and the cysts. Then the trophozoites are very large, so that's why they can be easily seen under a microscope. Then histopathology involves scrapping of colonic and cecal mucosa, where we can get the samples and stain them with hematoxylin and eosin. Then we can also scrap the ulcers via sigmoidoscopy, and then we review the clusters of the trophozoites. So treatment of balantidiasis includes taking metronidazole 3 times a day for 10 days. Then you can also use tetracycline 500 milligrams 4 times a day for 10 days as well. Time to test our memory and see whether we've understood. The first question reads, describe the life cycle of Balantidium coli. The second question reads, discuss in detail the pathogenesis of Balantidium coli. So feel free to go back to the video and rewatch if you haven't understood. Question 3 reads, write true or false for the following statements. So let's answer these together. Question 1. Balantidium coli belongs to the phylum Ciliophora. This is true. Second question, Balantidium coli is the largest protozoan parasites in humans. This is true. Third question, Balantidium coli is a zoonotic parasite. This is true. Fourth, the trophozoite stage of Balantidium coli is the infective stage. Well, this is false because we said the trophozoite stage is the invasive stage. Unlike Entamoeba histolytica, excitation of Balantidium coli cysts occurs in the large intestine. We said it occurs in the small intestine, not in the large, so this is false. Balantidium coli mainly resides in the small intestine. This is false because it resides in the large intestine. Both Balantidium coli and Entamoeba histolytica form round oval-shaped ulcers. Well, yes, Balantidium coli forms round oval-shaped ulcers, but Entamoeba histolytica forms flask-shaped ulcers, so this is false. Balantidiasis can be treated with tetracycline. This is true. Balantidium coli is an opportunistic parasite. This is true. Okay. So this is where we end our video. Don't forget to like, share, and subscribe, and also be notified for our future videos. With that being said, shalom, shalom.